Guys, I cried. I cried my eyes out. Like, I cried. I wailed. You know when you're crying, right? And you have your nose is running. I was not feeling my nose, rubbing my face. I was crying like a baby. I would say nursing school humbled me. Hard girl, hard girl. Welcome to my YouTube channel. My name is Shakira. Somebody sent me an email asking me that have I ever failed a course in nursing school, my reaction to it, and how I was able to succeed in the course. It was a really sad experience for me. I wouldn't lie to you. Like a very sad experience to me. And that was last semester. My SATs. Okay, so the exam is lab, so we do exams for it where you come to school, what you've been practicing, like you have somebody invigilating you and making sure that you carry out the skills according to the way you were taught. And there's always a rubric they follow for it. On this day, so what they advised was that make sure you don't come to school early. Make sure you come to school about 10 or 15 minutes before your scheduled time, because there's always a time frame for you before your scheduled time, so that you won't be scared or you won't have anxiety based on the information people, your classmate tells you, right? So I got to school about like 10 minutes, 15 minutes before my scheduled time. And when they called me, I went in. So the instructor that was invigilating me, looking at me, said, okay, let me know when you're ready to start. The moment you look at your scenario for the day, you started your SAT skills. I said, okay. So the moment, and I have just 10 minutes to carry out this exam, okay? And okay, the skills we're actually doing that day was for parental, like injection. So when I checked my scenarios, I was given insulin. Insulin is easy, right? Because you just draw, and the thing about insulin that you don't have issues with bubbles inside the syringe compared to heparin. So okay, so what I struggled with first. So before that day, during lab, they told us that okay, that if you want to open the med cart, the key will be there. You just open it, right? So when it got to my turn, the key wasn't where they said it was going to be. So I had to like look for the key and struggle with the cards. And in the rubric says you shouldn't struggle with anything. So that already doctored me mark, right? So I was able to do that. So the instructor now told me that the key is over there, and I opened it. So when I opened it, I checked, I compared the medication to what the doctor's order. So I compared it. I was like, okay, I was in the right track. I pulled out my syringe. I drew out my medication. I checked, and the moment you draw out your medication, and remember, I had just 10 minutes for this exam, and I would say that's like the fastest 10 minutes of my life. So when I drew out the medications, and okay, I was sure that okay, this is accurate. You're supposed to show your instructor, because when you're pulling insulin, you have to get somebody else to check what you've pulled out to avoid medication error. We know insulin is actually high alert medication, right? So you won't have to be very careful with it. So I went to show her the medication I pulled, I drew, and she was like, okay. And okay, before this time, I already went to see my patient, introduced myself to the patient, did my observation, my subjective and objective questions. I already asked my patient all that before going to the cart to pull the medication. So when I was now ready to go give my patient this medication, the moment I entered into a room, guys, guess what? The alarm rang, and that was 10 minutes. So I didn't give my patient the medication. I didn't do anything to my patient aside from the objective and subjective question, pulling the medication from the cart and drawing out the medication. That was what I did, guys. When she told me my time was up, I thought it was like, you know, when you hear an alarm ring, but maybe you were thinking that maybe somewhere else. That I now asked her that, is she not supposed to remind me that is she not supposed to give me a reminder that, okay, it's 2 minutes to the end of your exam, or it's 5 minutes to the end? She did not remind me, not knowing that at that level they were not supposed to remind us. If you're concerned, you're supposed to ask her, how many minutes more do I have? Guys, I just put my hands on my head and now asked her, can I do documentation? Like, I wasn't thinking right. I now asked her, can I do documentation? Which I know is not possible because you don't document before giving medication. You have to give your medication before documenting. She now said no. I now asked her, can I do like transfer of accountability? And now, like, when I asked her that, I was like, in my mind, I was like, but you did not give medication. Why would you want to do that? I was like, oh my God. I just put my hand on my head. I was like, and I was crying. Guys, I was crying. So when I get to the door, I just comforted myself. I just packed my stuff. I didn't know that other people have actually, like, many people have actually been going through the same, what I went through. I just go downstairs to meet my other classmates and my friends. I just started crying. Guys, I cried. The last time I cried like that was when I lost my dad. Hey God, I cried. They were not like begging me that, okay, I should stop that. Okay, let's do the calculations. Because in that, for lab, we have 2 exams that we do. And the other ones are skill check. Meanwhile, the first skill check, I failed it. So in my mind, okay, so out of the cutoff mark is 70, I got 68. And in my mind, I was like, okay, there's no big deal. I wasn't happy about it. I was like, okay, there's no big deal. I'll make up for when I do the next SAT, which is the one I just did that I didn't finish. So they were now like, my friends were now like, okay, let's see. The first one you did, you got 68. Okay, so that 68 is over. Also, 68% of 15 marks, right? So I was like, okay, she was like, oh, you got 68. You got, let's say, okay, you got 68 for the first one. Let's calculate it. Okay, that's about 10 point something. The next, okay, let's say this SAT, like, what are the things you did well? What are the things you did not? I said, I didn't do my documentation. I didn't give medication. I didn't give TOA. I didn't do transfer of accountability. I didn't do any of that. The only thing I did was pull medication out. My medication was complete. I did my normal checks and all. They were like, okay, they were like, did you ask for the subjective and objective question? I said, yes, I did. I was still, at this point, I was still crying. I now called my husband. I now told him that, babe, I didn't finish. I was literally crying on the phone when I was talking to him. He was like, is that all the exams you have for this course? I said, no. He now said, how many do you have? I said, I still have 1 exam and I still have some, like, 2 skills check and I still have attendance. He was like, okay, no problem. You can still do it. You can make it. Just make sure that you plan for the others. That wasn't the end of it though. Guys. So, and that day, I still have another exam. What am I supposed to do? Concentrate on the other exam that I have, Abby. Okay, so we, like, when I finished the skills check, when I finished the exam, I went for my other exam. After going for the other exam that I have, oh no, did I actually do an exam that day? No, I did not. That was the only exam I had for that day. So when I finished the exam, I now went to the coordinator that is in charge of second semester, and I went to her office to ask her that what's going to happen to everyone that didn't finish, that didn't complete the exam, that time actually went off. And part of the rubric for this exam is you must finish before time to get like a full mark for the time allotted, right? Because it's like, let's say 100%, but they're like, okay, did she do the subjective and objective question? If she did, give her 10. If she did not, give her. If she did not complete it, give her 7. If she did not do it at all, give her 0. So for instance, my TOA that I did not do, that's 0. My documentation, that is 0. Not administering the medication, that's 0. Do you understand? So I now went to her office. I went to her office to see if I was going to see her to talk about what went wrong. I didn't meet her in the office, and there was like an open space in her office. I just sat down there. Fortunately for me, my friend missing me, she called me to just check up on me. The moment I just picked up her phone, her call, I just started crying. Like, guys, I was crying. You know when you cry and you have runny nose, you have like your nose was actually running, and I was cleaning it, using it to clean my trousers. Like, it was, oh my god, I cried. I told her that I remember telling her that, oh my god, I failed myself, I failed my son, I failed my husband, that what exactly in my life can I actually do very well? She was not like, no, Modupe, don't say that to yourself. Don't say that to yourself. You can still make it. You can still do it. Guys, I was on the phone with her for almost 13 minutes and I was crying. Like, I was like, people that were now passing in front of, like, I don't even care about people that was going on around me. I didn't even look at their faces, probably like, oh, this person might know me, I should not cry. No, I cried. You know when you cry your eyes out and your face, my face was actually swollen. Yes, I cried. So she just spoke to me. She was like, oh, you can still make it, you can still pass the course. That how many marks is left? I said I still have about 50% left. Like, okay, you can still do this. What you just need to do is to keep practicing. I was like, okay. And after that day, I won't lie, I didn't cry again about it. I knew there's nothing I can actually do about it. And in my mind, I know I did not do well, that I definitely was going to fail the course because I did not finish. So when the results came out, I got 50% over 100, and the pass mark for that course is 70. So what are the feedback I got in respect to that what are the feedback I got? So all the time I was asking my instructor, can I do documentation? She said no. Can I do this? She made sure she wrote it down as part of my feedback, and it actually affected my professionalism. As a nurse, you have to be very accountable. No matter the situation, make sure you put yourself together and what is the next step. But I wasn't accountable for time at that moment. So I actually failed that course. So because I still had, that was like a midterm exam, right? So because I still had other courses, or I still had other exam for that course, I was able to do very well for it. My next exam, I got 98%. My skill check one, I got 100%, and the other one, I got about 90-something%. So I would say in all, I finished that course with 83%, yes. And it wasn't a good experience. But in all, I passed. That's what really matters, right? But, well, so because one thing I'm actually very scared of, even before returning back to school, I would not lie, I am scared of failure. I'm this kind of person that don't know how to handle failure. I don't, because I don't take it well. I don't. So ever since then, I make sure that I do the right thing and always look at my time, because as a nurse, right, time matters a lot, because when you have about 4 patients to look after, you need to learn how to prioritize, check the time, and yeah, that was my experience. But the good thing is that I passed the course and I got 83% overall in that course. So guys, that was my experience. And if this is your first time joining us today or watching this video, please subscribe to my YouTube channel. And if this is not your first time, thank you so much for coming back. Do enjoy the rest of your day. Bye.